Diaphragm is a curved muscular tendinous sheath attached to the circumference of the inferior thoracic aperture in the upper lumbar vertebra. Accordingly, this muscle has three parts or heads: the sternal head, which attaches to the sternum anteriorly, the costal head, which begins from the lower ribs on the right and on the left, and the lumbar head, represented by the right and left crura of the diaphragm, attached to the bodies of the second and third lumbar vertebra. All three parts converge to the tendinous center of the diaphragm and insert into it. The tendinous center serves as an attachment for the peripherally located muscular fibers of the diaphragm, like a white tendon between them. The fibrous pericardium, by the way, fuses with the tendinous center too. That's why the heart moves upward and downward following breathing movements of the diaphragm. The esophagus, aorta, and inferior vena cava cross the diaphragm, passing through its apertures. The inferior vena cava passes through an opening in the central tendon of the diaphragm at the level of the 8th thoracic vertebra. The esophagus passes through the muscular part of the diaphragm and enters the abdomen just to the left of the middle at the level of the 10th thoracic vertebra. And the descending thoracic aorta passes posterior to the diaphragm in the midline at the level of the 12th thoracic vertebra. In alive people, the vertebral levels are a little bit higher. The other structures which pass between the thorax and abdomen are the right and left vagus nerves, phrenic and subcostal nerves, thoracic duct, sympathetic trunks, the thoracic splanchnic nerves. What else do we have here? The right and left superior epigastric arteries, and our azygous and hemiazygous veins. We have four main sources of blood supply for the diaphragm. The first source is represented by the pericardiaco-phrenic arteries, which descend in front of the root of the lungs together with the phrenic nerves. The muscular phrenic arteries, which are the terminal branches of the internal thoracic arteries, give off some diaphragmatic branches too. Finally, the descending thoracic aorta gives off the superior and inferior diaphragmatic branches to supply the superior and inferior surfaces of this muscle. The diaphragm receives its motor and sensory innervation by the phrenic nerves. The right and left phrenic nerves are primarily supplied by the C4 spinal nerve, but there is also a contribution from C3 and C5 spinal nerves. From its origin in the neck, the nerve travels downward into the chest to pass between the heart and lungs towards the diaphragm. The nerve runs in front of the root of the lung and is accompanied by the pericardiaco-phrenic arteries and veins. Each nerve supplies only one dome of the diaphragm and provides sensory and sympathetic innervation to the adjacent pleura, pericardium, and peritoneum. Yes, you heard that right. The peritoneum on the lower surface of the diaphragm is also supplied by the phrenic nerve. Pain arising from the structures supplied by the phrenic nerve is often referred to other somatic regions served by spinal nerves C3 to C5. For example, a subphrenic abscess beneath the right diaphragm might cause a patient to feel pain in the right shoulder and right scapular region. The sensory branches of the intercostal nerves, they help to supply the peripheral parts of the diaphragmatic pleura and peritoneum. Well, unlike that, the motor function of the diaphragm depends entirely on the phrenic nerve. Each nerve supplies one half of the diaphragm. Synchronous contraction of this muscle leads to flattening of the diaphragm. It descends, increasing the volume of the thorax and facilitating the inspiration. Neck is a point of vulnerability for the phrenic nerve, as it runs vertically here on the surface of the anterior scalene muscle. Irritation of the phrenic nerve or the tissues supplied by this nerve leads to the hiccup reflex. Hiccup is a spasmodic contraction of the diaphragm which pulls air against the closed folds of the larynx. We are not dissecting the phrenic nerves in alive people, so please don't ask me how to stop it. The diaphragm is the major muscle of inspiration, responsible for the approximately 2/3 of quiet breathing in healthy humans. Contracting the dome of the diaphragm descends from 1.5 centimeters in quiet breathing to 10 centimeters in deep breathing. As it contracts, the cupula of the diaphragm descends, the volume of the thorax increases and the pressure inside of it decreases, sucking the air into the lungs. When the diaphragm relaxes, the cupula ascends back up, the volume of the thoracic cavity decreases and the pressure in it increases, squeezing the air out of the lungs. The elastic recoil of the lung tissue facilitates the expiration significantly. If we need to intensify the breathing movements, the intrinsic muscles of the thorax are getting involved. The complete denervation of the diaphragm may cause death. If only one nerve is damaged, you will see the paradoxical movements of this muscle. One can detect paralysis of the diaphragm radiologically by noting its paradoxical movement. Instead of descending as it normally would during inspiration due to diaphragmatic contraction, the paralyzed dome ascends as it is pushed superiorly by the abdominal viscera that are being compressed by the active contralateral dome. Instead of ascending during the expiration, the paralyzed dome descends in response to the positive pressure in the lungs. On this slide, you see a patient with bilateral diaphragmatic palsy due to motor neuron disease. Pay attention at the movements of his abdominal wall. When the chest expands, the abdominal wall is drawn in, and vice versa. Do you see it? Completely opposite to what we normally have. The paradoxical breathing is a sign of paralysis of the diaphragm, and in this particular case, both phrenic nerves are affected, and right and left.